breast cancer, as I said, it's really evolving. The other thing we're doing in surgery is minimizing side effects.
So what you're saying is we are incorporating AI.
Early detection and screening is absolutely the most important thing when it comes to breast cancer or any cancer. Does every person in India need mammogram? What is really helping is there's advancements in the field of medical oncology, which is chemotherapy, targeted therapy, immunotherapy, and being very personalized in the way we treat cancer rather than giving one bombardment of chemotherapy, right?
What could be the reason of, the shift of the age? Could it be the stress? Could it be the lifestyle that we are?
People think that only people with family history can get breast cancer.
Okay, yeah,
but
that's an
90
important
to
one.
95% of breast cancers are not related to any familial
Oh my
cause.
God. And why I asked you that is because whenever you think of breast cancer, you think that, one is going to lose the breast. So what are the most common misconceptions about breast cancer that you think people should be aware of?
How much time do we have, Rupali, today?
Breast cancer is one of the most common and life-altering challenges women are facing worldwide. Early detection and timely intervention can make a difference in survival and recovery. Joining me today is Dr. Karishma Kirti, a renowned breast cancer surgeon who has dedicated her life in saving lives and empowering women through her work.
So, Women Icons of India, I think it's a great platform that is bringing into the fore all the women that are doing great work throughout the country. And, while we're all doing our best for multiple different reasons. It could be passion, it could be a sense of the drive, the ambition, or just proving a point, or just for yourself to, or you might just love what you do. When you get celebrated or acknowledged for what you do, it gives you that little extra push. So I think it's an important thing that you're doing by acknowledging our efforts. And I thank you very much for giving me the love and the appreciation for the work that I do so passionately for my own happiness as well. But it's nice to be appreciated by someone else as well. Thank you.
Hi, Dr. Karishma. It's such a pleasure to have you on board for Women Icons of India platform. Thank you so much for coming.
Thank you, Rupali. It's a pleasure for me and such an honor to be selected and, chosen as one of the Women Icons of India. It's a real pleasure and an honor. Thank you so much.
Thank you so much. Dr. Karishma, we have seen your journey and it's quite a noble career that you are in. And, we would like to understand your journey. What inspired you? Was there any significant moment which actually shifted, or was it anything that was prominent that inspired you to be in this career?
It was a sort of series of fortunate events, I would say, that landed me in this career. I didn't start off as thinking that, I want to be a breast surgeon. I did want to do surgical oncology. And when I moved from my residency to Tata Memorial Hospital, which is an apex center for surgical oncology, I was in the breast oncology unit as an observer. But that unit is so dynamic, and breast surgery itself is a field that is really evolving right now. So there's a lot of new things coming up, and I think that was very exciting for me. And also I realized that, of course, in India we do have some limited resources, but even with those resources we are providing such good and state-of-the-art care for our patients, and that it is possible to do surgeries which are really cutting edge with the resources we have now, and for all the patients as much as possible. I think that's very important, bringing equity to the care that we give. And that was one of the very important things that I learned at my time at Tata. Furthermore, I was in France for a bit, and I think what I learned from there was perfectionism. They are so clear about even the littlest of when we do breast surgery, we talk about symmetry, and that was something that was really of high priority there. So I think that was one thing that I learned there. So lots of different things, and journey takes you through all, there's so many different phases and you learn a lot. But I think for me it was serendipity, being there at that moment that led me to choose and follow this field.
So, Dr. Karishma, what are the latest advancements in the breast cancer surgery which you think patients should be aware of? And are there any advancements in the coming decade that you're looking forward to?
It's a very good question. So, breast cancer, as I said, it's really evolving. So there's a lot that's happening. One is that we're able to preserve the breast for a lot of patients while removing the cancer, and that is safe and maybe even safer in early breast cancers than removing the entire breast. And that's very, very possible. The other thing that we're doing is when we remove the breast in some patients who have multiple tumors everywhere, for example, we are able to recreate that breast, whether that's done by using an implant or it's using patient's own tissue. That's also a very good possibility. The other thing we're doing in surgery is minimizing side effects. So saving the axillary lymph nodes, not removing all of it. You know, there's some lymph nodes or glands in the armpit which we have to remove as a part of surgery. So earlier all of them used to be removed, and now we do something known as sentinel lymph node biopsy. And even in patients in whom we are removing all the lymph nodes, we are doing a lymphovascular anastomosis. I know it's a big term. It just means that earlier there used to be a side effect in which there used to be arm swelling, which was known as lymphedema, because the lymph, which is one of the liquids which is present in the body, it was not getting drained. You know, you talk about lymphatic drainage, right? So it was not getting drained because we were removing lymph nodes which were on the way. Now we are taking those those vessels and putting them in the veins which are there, so that that road, that channel is still there for the lymphatic flow to be maintained. So that is something we're doing. Another exciting thing which I think is really going to come up. So in the next 10 years or so, what I think is really going to come up is robotic and endoscopic breast surgery, which was something I recently trained in last year in Taiwan, and minimally invasive surgery, which means, you know, those scars are a little bit away, not directly on the breast, not directly on the lump. So again, cosmetic coming to the front, but also being very, very mindful of our patient selection, not doing it for everybody, but only in patients who are, you know, well suited for this procedure.
The right candidate, correct.
And what is really helping is there's advancements in the field of medical oncology, which is chemotherapy, targeted therapy, immunotherapy, and being very personalized in the way we treat cancer rather than giving one bombardment of chemotherapy, right? So using the tumor tissue to understand exactly what kind of cancer it is and giving treatment for that kind of cancer, which is being, of course, more effective, but really, again, minimizing the side effects for the patients, you know, because we are concentrating on quality of life, concentrating on survivorship.
So what you're saying is we are incorporating AI even in the breast cancer surgery arena. Is that what it is?
Definitely. So, you know, AI in breast or in medical field has been there in some form or the other for a long time. You know, especially in radiology, it's been at least for a decade or so, and you know, it's just learning more and it's being talked about more. But yes, definitely, I think with the use of machines, for example, we did talk about robotics and stuff. It's definitely going to be talked about more, and going to be a more integral part of breast cancer, even surgery going forward.
So, Dr. Karishma, can you discuss the importance of early detection and regular screening?
Early detection and screening is absolutely the most important thing when it comes to breast cancer or any cancer. What does this mean really? So when anyone speaks of cancer, you may have heard of stages, which basically tells you at what level you catch the cancer at. Because most cancers are sort of the kind that grow in the breast, then spread to lymph nodes, or they may be spread everywhere, which is like starting from stage 0 or 1, going up to stage 4, which is, you know, spread out or metastatic disease. So when you have the outcomes, which means survival, disease-free survival, overall survival from treatment and from disease, it is very much based on what stage you catch or not. So somebody who has disease everywhere in liver, lung and brain is not going to have the same sort of survival that when you catch it early, that is in stage 0 and 1. And how do you find disease at this stage? The first and foremost is awareness, which is such a crucial part of screening and very often ignored. And that is why we are on social media. That is why we talk to people. That is why we conduct all of these camps, is to spread the awareness. What does breast cancer look like? And that is the crux of it, because a painless lump in the breast is always and more often than not ignored. So that awareness to reach to every person in the smallest village is going to take a lot, but I mean the practice and the effort is definitely there. So that is what we want, is people to come with as early a disease as they can, so that we can give them the best possible and the most limited treatment, so that we also avoid side effects, but also give them complete care and they live longer and better. after
Yeah.
having their treatment. And so awareness is one part of it. Of course, the other parts of screening is learning how to examine yourself, going to a doctor once a year, starting from the age of 30, and having your breasts examined. That's it. You know, the role of mammography comes later.
Yeah.
Maybe I would say it for in an urban setup. If you have any of the risk factors for breast cancer, maybe you can start having a mammogram starting at 40. Does every person in India need mammogram? It's not the need of the hour. Awareness, yes, I would say that's the most
Yeah.
crucial thing.
Yeah. And they used to say that, especially for breast cancer, they used to say you should start your early screening 40 plus, but not anymore. I think it's way earlier now. It is in the
Right,
30s.
right. So even for mammograms, the dictum even up to 2 years ago, the guidelines used to say 50 plus, and then we had newer studies which told you can start at 40 onwards, and this is so relevant for India because our median age at diagnosis is 48 to 46 years, whereas in the Western world it's 64 years. So
Okay.
they see a different type of
Yes.
cancer, they see it at a different age, whereas we see younger cancers. Whether that is because our population is younger or because we are seeing a different sort of cancer, that is very much under debate. Different studies would tell you different. It's probably a mixture of a lot of things. But I think when we're talking about starting mammography at the age of 40, when they used to say 50, I say maybe not for India. But now that the guidelines are saying 40 years, I am changing my stance a bit, and I'm saying yes, people in urban setup who have any of the other risk factors for breast cancer, yes, you can start your screening with mammography once every 2 years, starting at the age of 40.
What could be the reason of, the shift of the age? Could it be the stress? Could it be the lifestyle that we are?
So
do
a
we-
shift in age, as I said, that there could be a number of reasons which are not entirely clear to us.
Yeah.
But one of them, very, very prominently, is that 50% of our population is younger.
Yes.
Is the young population.
Yes.
So we see, whereas the Western world has more of an aging population, and
Absolutely
we will
right.
probably see
Yeah.
those cancers in the next 10, 15, 20 years.
Yeah.
But currently we are seeing a lot of younger women developing breast cancer, and this is also another piece of information that I would like to be a
Yeah.
takeaway, not just for patients but for the physicians and the gynecologists and all of those doctors that patients come for the first time with a breast complaint with. Very often it is thought, 30-year-old with a breast lump, it's going to be a fibroadenoma, which is a benign lump, which is rampant, which probably doesn't need very much, but it does need to be investigated to ensure that you're not missing a cancer. And just age
Absolutely.
does not rule out cancer.
Absolutely.
No one's immune to breast cancer, and that is a very important thing for everyone to understand.
So, what are the most common misconceptions about breast cancer that you think people should be aware of?
How much time do we have, Rupali, to do? So this is something I am perpetually struggling with, and I get asked all of these questions so many times. So first is age, which we just discussed,
Yeah.
that only old people get breast cancer. That's not true. The youngest breast cancer was seen in a 3-year-old, 8-year-old. So there
Oh
are
my
multiple
God.
instances, very, very rare, of course.
Yeah.
It is somewhat age-related, but that's not the only criteria. The second is gender. It's very commonly thought of that men can't get breast cancer because obviously
Oh,
they don't
wow.
have breasts. So
Yeah.
how can they get breast cancer? Understand that anatomically inside they still have those glands. They may not have matured, proliferated, or undergone the change that puberty has on
Yeah.
girls, but fundamentally, anatomically, the lobules, the ducts are still very much there. Men
Wow.
can get breast cancer. They are so unaware that they come to us after having symptoms for 1 year, 2 year, 3 years, which is so
Really late.
preventable,
Yeah.
right? Other thing, ridiculous things like underwire bras cause breast cancer, wearing black bra can cause breast cancer, putting deodorant can, cause breast cancer. Please put it on, let everyone around you smell you and have you smell better. So many. Mammography causes breast cancer
Oh.
to spread. So
Okay.
understand that neither the we give a compression to do a mammogram. That doesn't spread your breast cells. The radiation from the mammogram does not cause breast cancer. The other thing is that people think that biopsy can
Okay.
lead to an increase in the breast cancer. Anytime you get an injury, you get a little bit of swelling.
Yeah.
You might get a little bleeding. That may seem like the lump has increased a little bit. It will settle down. But there is no other way to diagnose breast cancer, and biopsy is not spreading or increasing your lump in any way. so many more. People think that only people with family history can get breast
Okay,
cancer.
yeah. Yeah,
but
that's an
90 to
important one. Yeah.
95% of breast cancers are not related to any
Oh
familial
my God,
cause.
okay.
And people also think that because I have family history of breast cancer, I'm definitely going to
Going
get
to
breast
get it,
cancer.
yeah.
That's also not true. So these were just some off the top of my head, but there's so many misconceptions. The other thing is people think that, oh, I have breast cancer. If I go to the hospital, they're going to cut off my breast,
Yeah.
and that's not true anymore. We are very able to, save the breast and give
Yes.
good treatment while maintaining the body form, the confidence, the self-image of.
That's
most
a lovely
women.
advancement that has
Yes.
happened in the breast cancer
Yes.
surgery. Yeah.
Yeah.
If someone has breast cancer, you actually can retain the breast. It's something very recent, and it is, I think it's very something great in this field.
I mean, yes, it is amazing, but it is not very recent.
Okay.
In the sense that the first sort of study started in the 1970s. So we're talking
Okay.
50 years down the line.
Okay.
But I will tell you, in India, the uptake has been slow. So
Yeah.
when I was doing my residency, as early as, like about 15 to 12 years ago, it was not even thought about. Breast cancer meant that we were doing mastectomy for everybody, doing
Yeah.
an axillary dissection for everybody. And when I moved to Tata Hospital, what I did realize that even though we were operating upwards of 30 patients a week and seeing 6,000 new cases a year of breast cancer, we were still able to give them the best care available,
Yeah.
which is doing the breast conservation surgery, which is limiting surgery in the axilla so that they get less side effects, and which is why I talked about having limited resources
Yeah.
in terms of infrastructure, in terms of number of people, seeing the number of patients. But
Yeah.
even so, we were able to give them that state of the art care.
Yeah.
And I think that's what's important, is that that shift in the way we think.
Yeah.
In fact, we did this CAP survey when we were at Tata, and we found that almost 30% to 40% of the of the doctors said that they were not or unable to offer breast conservation surgery to their patients because of their lack of knowledge or their lack
Oh.
of training.
Okay.
So I think it sort of highlights why there are breast cancer specialists,
Yeah.
and why there are surgical oncologists who do train to become breast cancer doctors. It's not just there are also surgeons doing breast cancer surgery, but are they doing the best possible
Yeah.
treatment for you? I'm sure some of them are, but I think that's what sets you apart, is having
Yeah.
that training and understanding how important it is.
Yeah.
Yes, safety from cancer and having that oncological safety is important, but can you give better quality of life to the patient? Isn't that
Absolutely.
important? Is just being cancer free or having that life after cancer,
Post-cancer.
really thriving post cancer treatment? And that is something that we want to bring to the forefront.
Yeah,
that
you
I
know,
would like to bring to the
And
forefront.
why I asked you that is because whenever you think of breast cancer, you think that, one is going to lose the breast. And that is not only a permanent physical change, but it's very emotional.
Very much so. And another thing that unfortunately happens is there are a lot of male decision makers in our society, in
Yes.
society everywhere in the
Yes.
world.
Yes.
And that mindset is, she's 50, she's 45, she doesn't need a breast, or you can just remove it, we want to be safe. And even though and that is what we want to put forward,
Yeah.
that it is as safe, if not safer, if you do your breast conservation, you receive your radiation, which is that you complete treatment,
Yeah.
then it is as safe as removing the entire breast. And it's easier said than done. If you ask a male person to remove any of their parts that they hold dear,
Yeah.
would they be as
True.
comfortable doing it? No, they would
True.
not be.
Yeah.
So that decision making, I think women should be confident of, learn about their disease, find out what's out there. And I think having that self-confidence is what's important.
So here
Also.
the awareness comes in
Yeah,
picture,
and
the more and more of awareness. Yeah. that
Yes,
you said.
yes. And also counseling by the doctor.
Yeah.
Who's there to give you knowledge? Yes, you can go online and find all sorts of knowledge, but where do you confirm that from?
Yeah.
Right? That's why I never tell my patients that don't look up Google. I said, look up Google as much as you want, but come to me with your questions.
Yeah.
Don't believe everything you hear, because there is everybody with
Yeah, yeah,
with a
absolutely.
degree
Yes,
from Google
yes,
Academy
yes.
will
Yes.
sort of give you whatever opinion you like. Write any line on Google and they will find you
They'll
data
find
to support
everything.
it. But where do you get the correct information from? You need to come back to your doctor
Yeah.
and see and say, I read this. And more often than not, you will find that doctors are very receptive to it.
Yeah.
because if we are lost in a field that we are not comfortable with, even we would resort to that.
True, yeah.
You know, so that's
Yeah.
what I mean. So look up Google, but get your proper information from your doctor and make the correct treatment choices. Don't say whatever you say. You
Yeah.
know, you have to live with that decision. You have to make that choice.
Lovely, yeah.
And have that confidence to accept it. And that acceptance comes when you know that you are taking that call for yourself.
Yeah. So, how can one do a self examination at home?
Yes, very good question. And definitely do your self examination at home.
Yeah. Yeah.
So, everyone should sort of be breast aware
Yeah.
starting from the age of 20.
Yeah.
And also start your self breast examination at that age. So, if you're a mom or an aunt watching this, then this is something that should be a part of a conversation that you have with your daughter or
Yes,
your niece.
absolutely.
Because it is something that I hope that this next generation will take as a non-taboo subject,
Yes.
right? So self breast examination once a month, generally on the day your period gets over. So 5 to 10 days after your first day of period. So an easy way, 5 to 10 days, first day of period, it's very confusing. The day you throw away your last pad or wash your menstrual cup or throw away your last tampon, that's the day just examine yourself.
Okay. Yeah.
Okay, and how do you examine yourself? There are three main parts. One is learned, the second is look, and the third is locate. Now, learn is understanding the symptoms of breast cancer, and the most common symptom is a painless breast lump. Now, there are other changes that can also present at breast cancer, which is a redness of the skin or an ulcer or a wound on the breast that is not healing if you've shown it to your regular physician and they've given you an antibiotic, etc. Now, other changes can be changes in the nipple. For example, a discharge from the nipple, which is red or clear. Like a blood stain
Yes.
sort of nipple discharge, or a scabbing of the nipple. You know how you get an injury
Yeah.
and you have a scab, you
Yeah.
remove it and another
Yeah.
one comes. So something like that on the nipple. Other things like a increase in the size of one breast.
Okay.
Or a breast skin getting pulled in one area, or an orange peel-like appearance of the skin.
Okay.
That pitting
Yes,
sort of
yeah.
swelling. The other thing that can happen without the breast is a lump in the armpit or a lump in the neck. That's
Okay.
very, very rare. It can be due to any other infection also,
Okay.
but get it checked out.
Yeah.
So this is what you're looking for when you examine yourself. Now, the second part of learn, look, locate is looking, which is where you remove your top clothes and look at yourself in the mirror. Now, when you look at yourself in the mirror, stand straight with your arms relaxed, turn right, turn left, and see if any part of your breast is pulled in any direction or there's a swelling in any part. Then take your hands up and see if your nipples are moving in the same way, and then put them on your hip and bend forward and see if both the breasts are falling at the same way. So sometimes if you notice when you put your hands up and one nipple is down,
Yeah.
or you see a pulling in one
Yeah.
part of the skin, a very deep seated lump or a lump in the breast which is involving the ligaments inside
Yes,
or
understood,
something,
yeah.
they can present, they can, even if they can't be felt, they can be seen like this.
Okay.
So it's an important step,
Yeah.
not to be missed. The third part is locate, which is when you examine yourself. Now, to examine yourself, generally in a lying down position with a pillow under your back. To examine your left breast, you put your left hand behind, take your right hand, and with the flat part of your
Yeah.
fingers, press your breast tissue down and rotate. Now you can go round and round, up and down,
Yeah.
like a clock face, 12 o'clock, 1 o'clock, 2 o'clock. Anyway, but just understand to examine your entire breast. Press your nipple at the end to check if there's any discharge.
Okay.
Then feel something in your axilla. Do you feel any lump or something
Yeah.
slipping? Touch your neck to see if there's any swelling there. And that's it. The amount of time it's taken me to tell you what it's like, it takes
does
less
take
time,
less
to
time,
do it. Same thing for the other side. Lie down and do it. Then go for your shower, put some soap on your hands and just glide it over your breast once to see, upper part,
Yes.
any lump, you'll feel them better if you're
Yeah.
standing up. So this is a very, very, very doable.
Yeah.
A couple of things is that the first time you do it, you'll probably think that everything is something. Don't press your breast like this. Always remember to push it down and rotate. Then you're less likely to find any extra
Yes.
things or miss anything. And you may not find anything for 2-3 months, 2-3 years, 2-3 decades, but that doesn't mean you stop it. You continue to do it because consistency is where you will find the smallest of change.
I was just about to ask you that even after self examination, it is possible, right, that you might not find anything for a longer period of time, but you still could be
Yes,
a
yes, and
candidate.
consistency is so very,
Yeah.
very important. And you will know your breasts more than anyone else. You know, you come to me, everybody has a little bit of
Yes.
nodularity here and
Yeah.
a little lumpy feel
Yeah,
here.
yeah.
You will know what's your normal. One nipple is 1 centimeter
Yes.
higher than the other or more protruded, and that's your normal. You will notice your changes first. So
Yeah.
we take it very seriously when we have patients on follow up who say that, you know, I'm finding this here.
Yeah.
And we will take that as a very important
Note, yeah.
change. What the patient tells you is a change in their breast.
Lovely.
So that's important too.
So, Dr. Karishma, what is your message to women of India?
To the women of India, I would like to say that don't make breast or talking about breast a taboo. Talk about it. Teach your children that breast and talking about breast and breast cancer is not something shameful. It's just another body part. Teach them to examine themselves. Teach yourself to examine yourself and spread the knowledge, spread the awareness. Go for regular screenings and examinations. Does this prevent cancer from occurring at all? No, it doesn't. But it ensures that whatever cancer, should you ever develop it, we catch it at the earliest and that you can have a long, fruitful life being completely cured of cancer. Breast cancer is very, very curable if you come to us with an early stage disease. So a lot of women have this fear in their mind that, oh, I've got something in my breast and now I'll go to the hospital, I'll go to the doctor, I'll be diagnosed with breast cancer and then I'll have chemo, my hair will go, my breast will be chopped off. You know, do you think that cancer is going anywhere if you don't go to the doctor? It's going to be there, it's going to grow, and what could have been treated in a very small or simpler way is going to become more complicated. It would mean larger surgery, it would mean more chemo. So if you find something, understand that 8 out of 10 breast lumps are benign and go to your doctor. In that 20% chance that your lump or your breast symptom is something, you've gone there early and you're going to get the best possible care and still continue and go back to a life with a new normal. But you will be able to get through it, and as early you go, the better it is for you. Early diagnosis is key to a better treatment always for any cancer.
So, Dr. Karishma, here's your rapid fire round. Most underrated symptom of breast cancer.
Redness or infective looking breast in a young woman.
What are the risks of not opting for surgery?
Very obviously and straightforward. If you don't have surgery, the breast lump can grow. It can break through the skin and form an ulcer, and it can also spread to the other organs, which is one of the hallmarks of cancer, is that it can metastasize to other parts of the body like the liver, lung, brain, which can obviously be a life-threatening situation.
One thing you wish all women would know.
Breast cancer is very, very curable, especially in the earlier stages.
The most common myth about breast cancer.
I think the one I get the most is that underwired bras cause a block in lymphatic drainage and cause breast cancer. They don't.
Is breast cancer always genetic?
Not at all, actually. 90 to 95% of all breast cancers are not related to family history in any way and are what is known as sporadic breast cancers.
Can you preserve the breast after a cancer diagnosis?
Yes, very much so. We can preserve the breast and we can even recreate it if we need to excise the entire breast. Very, very rarely.
How painful is breast cancer surgery really?
There's so much that we do in breast cancer surgery, from a small lump removal to removing the entire breast and recreating it. So what I can tell you is that we do give blocks to all our patients so that at least for the next 24 to 48 hours or so, they feel quite comfortable, and then the pain is anyway limited. But smaller surgery, less pain. Bigger surgery using tissue from your abdomen, definitely a little more pain.
Can surgery cause the cancer to spread?
No, surgery is the only thing which definitely removes your cancer completely in the matter of minutes. So very important is to remove the entire cancer, from the root.
Can someone look normal and still have cancer?
Yes, very much so. You can't point out a patient or walking on down the street. If they have a small breast lump or something that's not even palpable to hand, they can have cancer without anyone knowing, without themselves knowing.
One sentence that could save a life.
Examine yourself. That's the only thing I will tell you. Become breast aware and examine yourself every month.
What a lovely conversation we are having, Dr. Karishma, and thank you so much for sharing all your valuable knowledge.
Thank you so much, Rupali. It was indeed a pleasure, and I'm always glad to come on a platform like this and spread knowledge about breast cancer, breast diseases, and just make the general public aware. And thank you for picking this very important topic and talking about it today.
Thank you so much.